Everyone, my name is Kristen Sutton with Launch New York, and welcome to today's Investor Network Q&A session with Gian. The session will be recorded for those unable to attend. For the format of this session, I will introduce our presenter, and then he will present his pitch. At the conclusion of the presentation, we will have time for questions. I would now like to introduce our presenter, Amit, founder of Gian. Amit, please take it away.
Great. Thanks, everyone. So as Kristen mentioned, my name is Amit Bhattacharya, the co-founder of Gian. We started Gian about a couple of years ago. And in the event you're curious, Gian means knowledge in Sanskrit. So the whole premise behind Gian, our vision, is to really transform grocery shopping to meet the evolving health needs. And when we talk about evolving health needs, it really refers to the crisis and chronic conditions that we're facing worldwide. And in the U.S. alone, I'm sure most of you are aware that it's affecting a large percentage of our population, 41%, about 133 million Americans. A large percentage of the healthcare costs comes out of is being driven by chronic conditions. And when you compare the healthcare costs for an individual with chronic conditions, about 5x when you compare to a healthy individual. And especially at this time of COVID-19, somebody with a pre-existing condition is even more prone to the implications of COVID-19, and they're more at risk. So it's even more prevalent these days. Now, in addition to the evolving health needs, there are a few other pieces as far as the digital grocery trends that I wanted to bring up, which are relevant to our strategy. First of all, if you think about it, the whole grocery industry is going through a huge transformation with the introduction of disruptors like Amazon, Whole Foods. They're introducing cashless stores like Amazon Go, where you can kind of walk in, pick up any food product that you want, and then walk out the store and you get a bill on your phone. In fact, this morning I was just seeing that Amazon has introduced these smart carts where you can put items into the cart and it automatically, again, it gets billed to your phone when you walk out the store. So a lot of introductions of technology in the grocery retail space. If you look at expansion of e-commerce, that's been tremendous through COVID-19. It's projected to grow by 60 billion by 2024. You also have the continued growth of food as medicine movement, the awareness about really the role that food plays in health. You have the expansion of health services in retail. They're introducing more full-time nutritionists in the grocery retail sector. In fact, if you look at Publix, for instance, they're introducing these telehealth centers in partnership with different health systems where you can walk in the store and you have access to a private room where you can go in and interface with the physician through telehealth, and there's different equipment to get biometrics data. So there's a lot more expansion in health services and really the focus on healthy eating. So what is the fundamental problem that we're trying to solve? Now, in spite of the fact that consumers are aware about the importance of healthy eating, they really have no way of getting visibility into the impact of a collection of food products on their health. So what I mean by that is if you look at a shopping cart, you've got 10, 15, 20 different items. How do I know what the collective impact of all these food products have on my health? And traditionally what they do is they look at one product at a time. They look at their label, or they might use a nutrition app to get the nutrition information for that particular product, or they just pick up something based on what they might have read. But there's no way to understand what is the collective impact of all those food products on your health. And the way we're trying to solve this is by building a SaaS-based platform called HealthCart. This is all on Microsoft Azure, so it's part of the Microsoft Startup Program. And through this platform, you have the ability to get real-time recommendations on the health impact of your shopping cart and specific food products that might be having a negative impact on different nutrients where you need to be low. And then also it allows you to understand what are healthier alternatives. So this is all happening real time as you're going grocery shopping, whether you're in the physical store or whether you're online. When you're in the physical store, you have access to a barcode scanner. So for instance, if you're going through the store and you're putting a shopping cart together, you can get that real-time visibility. You'll identify what food products are having negative impact and so forth. And this is both available in a standalone mode and also through a third-party retailer. So for instance, Amazon or Wegmans or Walmart can basically provide all these capabilities through our API and embed it into their platform to provide a seamless experience. So what is the value proposition? And there are three specific customer segments that I wanted to bring up here. One is the consumer. Obviously, we're providing visibility into what foods are right for them, and thereby improving the overall management of health and wellness, as we've talked about. From a retailer's perspective, it allows them to build that sticky customer relationship, which is really important right now in this day of disruptors such as Amazon and Whole Foods, as we've mentioned. It also gives them an opportunity to increase the profit margin and market share. And from a hospital's perspective, there's more and more focus on personalized healthcare. So this is one way of really provide that sort of personalized healthcare, thereby improving overall patient outcomes and quality indicators, which are really critical for reimbursement. So let me just spend a couple of minutes kind of talking about some aspects of the health cart platform. So what you see here is a Wegmans app where you can go in and order groceries online. And you'll see this is the shopping cart. And at the very bottom of the cart, you'll see there's this health cart score. So this helps you understand how healthy your shopping cart is. It goes from 0 to 100. The higher the score, the more healthy it is. And the area in yellow is really your target. And here you can see there's obviously areas for improvement. And you can see that there's one specific product here, provolone cheese, that's having a negative impact in terms of fat, saturated fat, and sodium. And when you tap on Healthy Swap, you can see exactly what are healthier alternatives in that category. When you tap on this triangle, it helps you understand exactly what is your current levels as far as these three different nutrients, and what is their desired range. We also have this nutrition service, as I mentioned. Wegmans can leverage all these capabilities and through our API and provide it through their own app. Users also have the ability to objectively see what is the impact of healthy eating. So through a dashboard, they can see over time, as their health card score is improving, what's happening to key metrics such as their weight, their blood pressure, their glucose levels. So on the back end, we are essentially integrating with EMR systems, with wearables, connected devices. So we just finished our Google Fit integration so that any device that's part of the Google Fit ecosystem, we're able to get that data. We're expanding to Apple Health. We've integrated with Athena Health. We'll be integrating with Epic as part of our pilot. So that allows us to get that clinical data as well as lifestyle data, which is then used to drive these recommendations. So that's really the whole personalization aspect. And then lastly, you have the care coordination piece, which really allows users the ability to share information with their care coordinators or the care managers. So one of the big gaps in health systems is really the food component. So let's say, for instance, I'm prone to get kidney stone disease, and I have it removed, and then I have a discussion with my physician, who then gives me instructions on how to change my diet. I walk out the door. There's really no visibility into what that patient is doing in terms of grocery shopping. Also, the patient, when they are out there buying food products, they don't get that real-time guidance in terms of what is good for them. So through Gian, they'll be able to get that guidance, but also the physicians and the care managers have the ability to see exactly what they're buying so they can be more proactive and reach out to them before any complications arise. And this is actually one of the pilots that we're doing with the University of Rochester Medical Center. Now, from competitive analysis, there are a few products here that I wanted to call out. One is Yuka. Yuka is very popular in Europe, and they actually give you the ability to see exactly what food products are good for you and what's not. Kroger, OptUp. So this is a product that Kroger launched about a couple of years ago, which does very, very similar things as us, but there are key differences also. So they give you the ability to get that health component for an entire shopping cart, but it's not done real time. So it's basically after the fact, based on your purchases. It's also not connected to EMR systems or wearables or so forth, or connected devices. And they use a much more simplistic model in terms of the recommendations that they're providing. In fact, we had a conversation with Kroger, president of their health division, and they were very interested in learning what we had to offer, but they have their own platform. So anyway, and then we've got ShopWell and FoodSwitch, which are a couple of other applications that allow you to understand the nutritional impact of one product at a time. And that's the main difference, aside from Kroger, is that these other applications only deal with one product at a time. There's nothing that gives you the ability to really understand what is the nutritional impact of the entire shopping cart in real time, and allows us to feed in data as far as your clinical condition and your lifestyle and so forth, and be able to share that with care managers. And by the way, going back here, to kind of give you an idea of how popular this is, Yuka, they have, I believe, a current user base of a few million in Europe, and that was in a fairly short period of time. So it's a fairly simplistic application. You can see the need that consumers have for something like this. Now, in terms of our revenue model, there are two specific areas that we're focused on. One is the direct-to-consumer, and the other one is the grocery retail or the API-based model. So in the direct-to-consumer, we're looking at offering a freemium model and a subscription-based model. So in the freemium one, we're looking at embedding advertisements and giving consumers the ability to access limited capabilities. And in the enhanced model, the subscription one, there will be a monthly fee of $4.99 for unlimited access. And obviously, there won't be any ads as part of that. So we're looking at going live with that right now in Q4 of this year. Once we've either completed or made a good progress on our pilots, which I'll talk about in a few minutes. And going forward, as far as the API-based model, we've cast a wide net across grocery retailers, hospitals, health insurers, and so forth. But the one that I'm mentioning here is really grocery retailers. And what we've discussed is the potential with some grocery retailers is potentially an API licensing model where they would give us basically a certain amount per year for unlimited access to Gian's capability. Now, in terms of the direct-to-consumer model, what does that user persona look like? So it's somebody who does a lot of online grocery shopping, either for pickup or delivery. It's somebody who's facing difficulty in managing chronic conditions. As I mentioned here, the 5 that we're focused on right now are diabetes, hypertension, obesity, cardiovascular disease, and chronic kidney disease. And adding more chronic conditions is just a configuration exercise. And our plans are to expand beyond this to cover really all the chronic conditions. But we wanted to focus on the most prevalent ones right now. The chart here kind of shows you what is our opportunity over the next 5 years. So we're looking at rolling it out in New York State first, followed by the rest of the U.S. And you can see it's a fairly good opportunity in terms of growth. This is the B2B model. And what we're estimating as far as the annual growth rate in terms of online grocery purchases and how that translates to in terms of potential market opportunity. So in terms of what have you accomplished since 2018, there are a few I wanted to call out here. One is really all the pilots that we planned with several different organizations. So you can see here there's Wegmans and University of Rochester Medical Center. So we have actually multiple pilots that have been planned with both those organizations. So one is with orthopedics department, and this is for pre-surgery prep and post-surgery recovery. So somebody, for instance, who needs to get a hip replacement and they're obese and they need to lose weight, Gian will be used to give them that real-time guidance, and care managers will have visibility into what they're buying. And that phase 1 for that pilot has actually started already. So we are recruiting patients right now. Our goal is to recruit 200. We've got about 75 right now. COVID-19 kind of brought that recruitment to a halt because all research projects came to a halt for about 3 months or so. But we've recently restarted that, and they're getting a lot of good interest. So we're hoping to reach that 200 by in the next probably 2 to 3 weeks, and after which we'll start phase 2. And phase 2 really gives patients access to HealthCard, and we'll be doing all the things that I mentioned. The next pilot is with the urology department. So this is a use case that I mentioned with as far as people with chronic kidney disease. So somebody, again, who's had kidney stones removed, they have that conversation with their physician where he provides guidance on nutrition changes, and then when they walk out the door, they'll have the ability to access Gian for real-time guidance, and the care managers will have visibility into what they're shopping. And the third one is called the CHAMP program. and this is for adolescent malnutrition as part of the sports nutrition program. So U of R works with all the schools, both in the suburbs and the city of Rochester, with the adolescents and specifically the sports programs from a nutrition perspective. So they want to use Gian to kind of, teach life skills to the students, also be able to monitor in real time the impact of nutrition on key metrics that they're monitoring. So that's something that's probably going to get rolled out in the Q3, Q4 of this year. They're going to start with the suburban schools and then move on to the city schools. We also have a couple of pilots that have been planned with the YMCA. So one was with the Healthy Weight and Your Child and program, which deals with obesity challenges with adolescents and the whole families involved. And the second one is with the diabetes prevention program. So recruitment for both those pilots had started pre-COVID-19, and we were getting good interest. But again, similar to your MC, those pilots, the recruitment came to a halt once we were in lockdown. And at this point, there's no clear guideline in terms of when the gyms are going to reopen. So as soon as the YMCA reopens, we'll restart that pilot. We also have received investments so far from a few different fronts. One is we received a $50K angel investment. They've also received investment from Launch New York. And we also received a grant from NextCorp, and specifically the RG&E grant. In addition to Launch New York, we're also part of NextCorp in Rochester, New York. We also have several very interesting partnership discussions underway with Advanced Pain Management out of Wisconsin, and also Basket Savings, which is an e-commerce player. And we've also had discussions with Albertsons and Loblaws out of Canada. And there's also a pilot planning underway with Continente Grocery Store, which is the largest grocery store chain in Portugal. They're very interested in leveraging our capabilities as part of their own platform, but they're right now focused on trying to clean up the data before we get started with that. So the expectation is that around Q4 is when we'll start getting into that. And then there's the American Diabetes Association. They actually have an application called the Food Hub, whereby people dealing with chronic conditions can get guidance in terms of meals. And they're actually expanding that to include grocery delivery. So you can essentially see all the ingredients and then automatically get that delivered to your house. And what's missing right now is that whole health component that's available through Gian. So they're very interested in leveraging Gian's capabilities and then embed that as part of Food Hub. In terms of our lease target right now, it's around 500K. And as you can see, key objectives for that raise is really allowing us to successfully conduct all the pilots that I mentioned, and then also that by which we can prove that Gian can drive the behavior changes as it relates to grocery purchases. So just because you have technology doesn't mean it's going to drive behavior change, and that's one of the key things that we want to prove through these pilots, and in addition to the effectiveness of health card and then obviously the usability testing piece. The capital will be used specifically to increase the headcount and specifically in the technology side. There's a whole product build out and testing piece. One of the key components successful is the data itself. So for instance, for the direct-to-consumer launch, we need access to data for products that are sold in all the grocery stores nationwide, and getting access to that data is expensive. So far, with the Wegmans pilot, they have provided us with all the data. There's still gaps from that we're trying to close because a lot of these grocery stores themselves don't have all the data in terms of the nutrition for all these different products that are out there. So that's one big component that the capital would be used for. Then obviously there's the pilot support in terms of working with these different organizations and the different individuals that are part of the pilot in terms of providing the day-to-day support. There's a Microsoft Azure hosting piece. So we're part of the Microsoft Starter program, as I mentioned, because of which we have free access right now to all the Azure hardware and software. And, we recently, they extended it to a second year. So that's going to expire in March of next year. So beyond that, unless they extend another year, there'll be some cost associated with that. And then lastly, there's the patent submission and legal fees. So all the things that I mentioned, we actually have a non-provisional patent for that. So there's obviously ongoing fees associated with that as we update the patents. In terms of the potential path forward from these pilots, as I mentioned, we have a number of very interesting discussions going on. And the common theme across all these different organizations is that they want to see the pilot data before they move forward with any sort of implementation. And so there's huge opportunity once we have these successful pilots in terms of potential partnership or investment from any one of these organizations. A little bit about myself and my co-founder. So I have 20 years of experience in the IT industry. I used to work at Xerox for about 10 years, after which I joined another healthcare startup called Ibetics. Actually, before that, I was at an e-learning company for 14 years called Element K, which was eventually bought out by Skillsoft. After which I joined the startup called Ibetics, where I ran the whole healthcare practice. And towards the end of that is when I started Gian about a couple of years ago. In terms of education, I have an MBA from U of R, Simon School, a master's in electrical engineering from U of R, and then a bachelor's in electrical engineering from RPI near Albany. JM has over 30 years of experience in IT. He used to work at Kodak, so he's had several managerial positions, in Europe, Middle East, and the U.S. He has a PhD in informatics and automation from France, and he and I met at Ibetics. So this is the second healthcare startup. Also, he was the CTO at Ibetics, and there are more details about the extended team that's available in the appendix. So let me stop there and see if there are any questions.
Great presentation. Now we have some time for questions, so please jump right in with any questions you may have.
Yeah, this is Siva. Hi, Amit. A couple questions here. Will this only work if you're doing online shopping, or if I'm just taking the cart and just doing a self shopping at the store? How does it work?
Yeah, it's a good question. So obviously online shopping is a pretty seamless experience, right? So you go in, you build your shopping cart, you get that sort of real-time guidance. When you're going in the physical store, we have the barcode scanner that you can scan the food products, but obviously, that's you don't want, consumers are not going to want to do that every single time they pick up a food product. So what's happening now is that because of COVID-19, people want to spend less time in the grocery store. They just want to go in and out. So a lot of them, they put together their grocery list before they actually walk in the store. So Gian can be used to put that grocery list before you actually walk in the store. But when you're in the store, and if there are any particular products that you want to pick up, you can always use that barcode scanner to scan that product and see what the impact is to the overall shopping cart. Now, having said that, that's the current state. But over the next few years, you're going to see things changing dramatically. So as I mentioned, Amazon is introducing the smart cart, whereby you the product in the cart and the product cart actually
Amit, you're cutting out just a little bit. Your reception is not great where you are.
Okay, is that any better?
Yes, that's much better.
Okay, I'm not sure where did I cut off there?
Maybe the last sentence or two.
Okay, so as I mentioned, you'll see a lot of changes in the grocery industry over the next few years. For instance, the introduction of smart carts that, as I mentioned earlier, Amazon has introduced, and you're seeing more and more of that in different grocery retailers where you put the products into the shopping cart, you have a tablet at the front of the cart that automatically gets updated, so you'd be provided those alerts. So it becomes kind of a merging of the physical and the online space. So hopefully that answers your question.
Yeah, thank you. What is the patent that you guys filed for? What is the IP here?
So the IP here is really all the science behind the calculations. So, that health card score, it's one number, but there's a lot of math that's going on behind the scenes where we're looking at your clinical data, whether you have diabetes, hypertension, we're looking at your weight, and a lot of other factors. We're looking at your consumption levels, and then all of that is feeding into and looking at the nutrition data for all these food products and coming up with that health card score. So a lot of the patent is tied to that in terms of how do you actually come up with that health card score.
Okay. I have done a lot of work in this area. That's why I'm really interested in what you guys are doing. I have a lot of different ideas than what you have here. Much more advanced, which would be very nice. But let me get to the valuation here. You said you're looking for 500 at what valuation?
So the valuation, the last valuation that we did with, I gotta get the number here, one second here. It was with Launch New York. I believe it was around, if I remember correctly, I think it was around 70 cents or so per share. It was around 6 million shares.
6 million. So you're looking at about 44.2 million valuation.
Yeah, I'm trying to get the exact number here. Give me a second. Yeah, it was around there. It was around 3.5 to 4 million.
Okay. So
Was the last valuation.
Today you don't have any revenues, right? Do you?
I'm sorry?
Do you have any revenues coming in?
No, it's all in pre-revenue right now.
Okay. So you're still in the pilot stage, basically.
Yeah. I mentioned with the University of Rochester Medical Center, with Wegmans, with YMCA. But we're fairly confident that, once we actually get this in there, that, talk to a number of different organizations, and overwhelmingly, there's a ton of interest in something like this. In fact, I didn't mention, but we just had a conversation with Tops Supermarket about a week ago, and they're very interested in what we're doing.
So if you go API route to the groceries, how do you get paid? How do you get paid?
So in terms of how we get paid, there are different potential avenues. One is, as I mentioned, the direct-to-consumer model, right? We want to actually have this available in the App Store, so consumers can download it and start using it.
Right, I got that. I'm saying
that makes sense. Now, on the B2B model,
second part is what I meant.
Yeah, so on the B2B model, one is through grocery retailers, right? They want to make this available through their application, like a Walmart or Amazon or Wegmans. They would pay us a certain amount for a licensing fee per year. The other one is through health insurance. So we've actually had conversations with Excellus and MVP over here in Rochester, New York. So MVP has mentioned they'd be open to having a model similar to what with Silver Sneakers. So Silver Sneakers, in the event you're not familiar, is for gym membership for the Medicare population. So basically, they can access any of the gyms and for free, and basically MVP covers that cost. So similar to that, they would pay us a certain amount per member per month for unlimited access to Gian, regardless of what grocery stores that they go to. So that's another potential avenue for revenue. Another third one is that, you've got these health systems where they're very interested in really expanding personalized healthcare. So, for instance, the pilots that we're doing with the University of Rochester Medical Center, where we're focused on orthopedics and urology. So if you're really successful in those two departments, for example, then URMC might be interested in basically making that available to their patient population. And there would be a certain cost associated with that. And you also have other players like Basket Savings, e-commerce players, Instacart, where if they wanted to leverage our capabilities and really provide that health component as part of their user experience, there would be a licensing fee associated with that.
Okay. All right. Yeah, I mean, the 500, is that a convertible note you're looking at, or an equity? What are you planning on? How are you planning on raising the money?
Really open to any of those specific areas. So it could be a convertible note, could be equity. So that's a discussion we can have.
Yeah, and I'd like to see a little bit more of your financial model and see what your projections are and what you're thinking in the next few years.
Definitely, yeah.
We can have another call or go through the details. If you have that, you can send it to me and we can go through it. For sure. Yeah, that's what I'd like to. I'd like to see if we can have a little bit more in-depth discussion. See if we can get somewhere. If we we can, that's fine. If we can, that would be great.
Yeah, no, definitely. Yeah, we can do that.
Sure. Seva, I will definitely connect you and any other interested investors with the Gian team after this call.
Yeah, that'd be great, Kristen. I'd love to get more detail and see what we can do.
Sure.
Yeah, and I can also, during that call, I can give you a demo of the platform. So what I just showed,
Yeah,
the presentation
that would
was
be
just
great.
one
That'd be great.
screenshot.
Yeah, I'm not just going to waste your time. I'm pretty serious here. Like I said, I have a lot of background in this area, starting from healthcare all the way to the wellness. And actually, I'm neither a doctor nor a healthcare specialist, but through my own family experiences, we were able to fix a lot of my diabetes and my problem for my wife on the heartburn and that kind of stuff. So it's all self-learned, research-based stuff, but we have proven results.
Right, right. No, I agree. In fact, one of the drivers for me starting this was personal experience. I mean, I was pre-diabetic, and I changed my diet, and that changed everything. So I concur with what you're
Yeah, I
saying.
mean, there's a lot of things. I mean, it's not just the diet. I mean, that's basically why
Yeah,
I want to dig more detail and see what you're thinking, and maybe I'm interested in playing a pretty key role if things work out. We'll talk. We'll talk
yeah,
details. I don't want to get into the weeds here, but let's look at more on the financials and the product and see where things are, and we can go from there.
yeah, definitely.
Great. Are there any other questions for the Gian team?
Hi, this is Don Delaria. I've got a couple of questions, and I apologize. I had to step away briefly, so I apologize if you covered this already. But are you looking to target single shopper, like single grocery shoppers shopping for just one person, and or if not, how are you going to account for somebody maybe shopping for the family?
Yeah, great point. So in fact, we have that built into our platform. So when you actually buy the food product, you identify who you're buying it for, whether it's
Okay.
just for me or somebody else in my family or the entire family. So we have a whole family concept where you can essentially invite other people from the family into your pool. So then when you go grocery shopping, you can identify who you're buying it for. And we have plans to kind of go beyond that and really help you understand if you're buying it for somebody else, beyond just the impact to yourself, how it's going to impact that person also. So we have a lot of very interesting things built into the platform right now, but we have plans to expand it beyond further to really kind of go more and more in depth into the whole family concept.
Great. Thank you. That definitely answers that question. Second question would be around, dang it. You said you had barcode scanning, is that right?
Yes,
For
we
the
do. Yeah.
products? Okay, so
Yeah.
that was okay. So it sounds like you've got decent functionality. Is there are grocery stores that have apps already or loyalty programs and whatnot? Do they not already have some sort of healthy swap functionality built in, or is that something that's they're starting to add, or are they not? Is that not on their radar at all?
No, it's there, but if you look at all these stores, in fact, all the applications that are out there, they all look at only one product at a time. So
Okay.
if I'm buying, for instance, Coke, it'll tell you what is the health impact of Coke. But if I've got Coke and beef and broccoli and cheddar cheese and everything else in my shopping cart, they have no means of helping you understand what is the impact of the overall shopping cart on your health, and helps you and kind of looks at all the interactions between all those products, and then it helps you understand, okay, this specific product is going to have a negative impact and so forth. So aside from Kroger, nobody else has that, and Kroger is a much more simplistic model than us, and it's not real time. They do it after the fact, after all the purchases, whereas with us, it's all real time. They're not connecting to EMR systems or wearables, so none of them are getting clinical data or lifestyle data. And by the way, one thing that I did mention is beyond just helping you kind of flagging food products that are going to have a negative impact, we also help you understand if you're low in different nutrients, which food products will help you increase that. And none of these grocery stores help you do that. So, for instance, if you're low in fiber, we'll help you identify exactly what categories will help you increase the fiber level and what products within those categories will help you increase it. And if you're, let's say, if there are no healthier alternatives, but certain products are contributing to a high level of fat, we also help you identify, help you understand by priority what food products are negatively impacting fat, so you can reduce the quantity or remove it from the grocery list. So all the things that I just mentioned, none of them offer that.
Good, thank you. That's very helpful.
Any other questions? Great. Thank you for taking the time today to learn more about Gian. I will connect each investor with the Gian team for any follow-up questions you may have. If you need any more information at any time, please do not hesitate to reach out to Matt or I. Please have a great rest of your day. Bye.
Thank you.
Okay, great. Thanks everyone.